Okay, so what this person is saying is, in regards to the quality metrics, why do doctors just say, you know what, forget the bonus, I don't care about these metrics, I'm going to keep seeing patients and I'm not going to do X, Y, and Z? This is a good point, and this is actually something that I did when I worked for hospitals, is I never wanted the quality bonus. I told them that during my interview process, that after looking at what the different metrics were, and one in particular at one of my jobs, I just really did not agree with. And this metric was statin therapy in patients who had a diagnosis of hyperlipidemia on their chart. And the reason I didn't agree with this metric in general was because statins have side effects, significant side effects. They have medication interactions. You should not take them if you are trying to become pregnant. And the way that the metric was written was that basically anybody who had the hyperlipidemia code on their chart needed to be prescribed a statin, and that's not how I practice medicine. I use something called the ASCVD risk calculator index scoring, and that's where we put a lot of different factors, numbers into this large calculator and get an overall risk assessment to discuss with the patient, because not everybody who has high cholesterol needs to be on a statin. So yeah, I pretty much just refused to even comply with that one. And what the quality metrics team came around and told me, because they would often come around with everybody's scores and they would show like, oh, look, Dr. Hendry's not meeting her scores. Like, yeah, I'm aware. Told you guys from day one I would not be meeting these scores. So there's a lot of like shame that goes into that. They try to embarrass you in front of your peers, but thankfully I could not be embarrassed, and I just really knew from day one I didn't care about getting the bonus. But that doesn't work for everybody, and a lot of these hospital systems really pressure doctors to follow these quality metric indicators. And so in regards to the statin metric, what the quality team told me about this, after I voiced my opinion about it being ridiculous and I wasn't going to do it, was that, well, look, to get these patients out of your denominator and help you get your bonus, just put on the chart that they have an intolerance to statins. Well, then my next question was like, well, how do I know if they have an intolerance if I'm not going to prescribe it? Because I did not feel comfortable putting that documentation on their chart. Well, then you ask yourself, okay, well, just don't put the code hyperlipidemia on their chart. So then that patient doesn't fall into your numerator or denominator for that metric. Well, the issue is insurance companies won't pay for the repeat lipid panel unless you use the diagnosis of hyperlipidemia. If you get the elevated cholesterol on the screening test, in order to do the 6-month follow-up test, you have to code hyperlipidemia. So, I mean, there was no way around it, and I have never gotten a quality bonus, and will never get one because I'm never taking insurance again, but that's kind of how that whole process works.